This is the Illimitable Experience podcast. Hello and welcome to another episode of the Illimitable Experience podcast. If you're watching this video, like this video, and if you haven't subscribed to the channel, do subscribe to the channel. We are posting great content regularly. With that, today we have as our guest Ajinkya Raut. Hi Ajinkya, how are you?
Hi Manan, I'm great. Thank you so much.
Yeah, Ajinkya, it's a pleasure to have you today. I am aware that you are a dentist, but can you just introduce yourself of about what you do and who you are?
Sure. Thank you so much. So I'm Dr. Ajinkya Raut, and I'm a dentist by profession, and I'm a general dentist, which means what? That I do all forms of dentistry. I'm not really a specialist, but I practice general dentistry, and I've been practicing since the year 2011. That gives me, in fact, 2008. In fact, I'm supposed to, count those also. 2011 is when I started my practice, and I've been practicing since 2008. So that gives me 14 years of experience. And we dentists probably continue practicing all through our life. So yes, it's been a great journey so far, and I definitely enjoy my work.
Wow, that's really great to hear. Now, Ajinkya, as a how did you get into being a dentist? Like, was it always your dream to be a dentist, or was it that something else happened, the situation or something was different? That is how you chose to become a dentist. बिकॉज लाइफ में
Uh,
ऐसा कैसा कुछ ना सबका ऐसा इंसिडेंट हुआ रहता है जो ये पूरे एक लाइफ टाइम का एक गोल सेट कर देता है या ऐसा कुछ था.
so Manan, बहुत ही funny story है actually.
Yeah.
So my uncle happens to be into computers. I mean, he's an engineer. He's a BE electrical engineering. But so 90s was the time when the whole computer boom had happened. And to say so, in our locality or in our region, he was one of the few people. In fact, he was one of the first ones to get a computer,
Oh,
and
wow.
he was also a tutor at computer classes and so on and so forth. And eventually he started his own computer trading business.
Mm.
And because of the exposure to computer, I was always inclined. So probably when I must be 7 or 8, I
Mm.
was exposed to programs like WordStar, DBase, which you probably might not even hear now. There was a program called Lotus, which is what Excel is today. So all of these things, I was in fact I had mastered. I won't boast, but my mom would call me from her office and ask me, "Iska command kya hai? Uska command kya hai?" So
अच्छा.
it was a given that Ajinkya will get into computers only.
Mm.
It was a given, and till the 10th standard, I was very very clear that I want to get into computer engineering. I mean, there were
Mm.
no two ways about it. But I was very much a kitabi kida, and I honestly did not know the world outside, and
Mm.
I did not even know how to get into engineering. All I knew is that I need to score good marks in science and maths,
Mm.
and
Mm.
that should be, and I will get an admission in engineering college. But it so happened that in the 10th standard, my same uncle took me out on a drive and he said, "What do you want to do?" So I said,
Mm.
"I want to become a computer engineer." And he's like, "Are you crazy? By the time you become a computer engineer, there are going to be a lot many engineers outside, and you will
Mm.
be facing tough competition. And there's nobody in the house who's a doctor, and doctor is a very noble profession and
Mm.
very respectable profession, and nobody in the
Mm.
house is a doctor." I think that line probably hit me, or I would say influenced me uh, to get into the medical space. But जो बंदा पहले से ही इंजीनियरिंग की लट लगा रहा हो, उसको मेडिकल के बारे में कुछ भी नहीं पता था. So in my
Correct.
11th standard, in fact, after the 10th admission, you're supposed to ideally take admission for CET and the entrance test. And
Mm.
I didn't know anything about it. Okay, but eventually I took admission, and I started my classes, and that is around the time when I got my first root canal done.
Yeah.
And though it was painful, I really liked my dentists.
Mm.
I'm still in touch with them, Dr. Aditya, Dr. Meenu, and that's where I think the whole story started to get into dentistry. because I felt again when I spoke to the dentist, he said, "Yeah, this is like a good job. There are no night calls. There are no nighttime calls. You don't have to rush to the hospital doing something. No sleep is disturbed." I said, "And you make good money also." So, but things changed. But anyway, so
Hmm.
I guess that drove me to getting into dentistry, and that's how, in
Hmm.
fact, I got into dentistry. And there was honestly speaking, there was a self doubt कि मेडिकल तो अपने से होगा नहीं, वी आर नॉट दैट इंटेलिजेंट, डेंटिस्ट्री हो जाएगा तो डेंटिस्ट्री कर लेंगे, that kind of a thing. And eventually, and to be honest, when I visited my dentists, I really liked them, and
Hmm.
I thought, yeah, this is a good thing to do. With absolutely no clue what does dentistry entail apart from root canals and fillings. What does that mean to be a dentist? But then,
Hmm.
yeah, I'm here and I'm thoroughly enjoying it.
Right, right. That's a great story. I mean, there's always this one-liners that people must have heard in their lives that really, pushes them in a different direction. The same thing with you happened as well. And
Yeah,
I've always felt that I think dentists are one of the doctors. I mean, obviously, all the doctors do have this skill, but dentists particularly have this special knack of dealing with kids as well as the adults very well. Now, I don't know why I feel that way, but I think it is when a kid goes to a dentist for the first time, right? वो जो machine equipments होते हैं, वो जो noise होता है, वो machine का cleaning machine का, that actually kind of intimidates the kid. So
absolutely.
इसलिए there is a special knack I think that dentists have to deal with kids as well. So
Yeah.
uh, now अजिंक्य, मुझे एक कल्चरल क्वेश्चन है, ठीक है?
Hmm.
ये जो कुछ कुछ सीरीज होती है, जैसे मैंने फ्रेंड्स में एक बार सुना है, एंड और भी कोई सीरीज में मैंने उसे एक दो बार सुना है कि कायरोप्रैक्टर्स है, डेंटिस्ट है, या जिन्होंने पीएचडी की होती है, उनको हम ऐसा डॉक्टर बुलाए तो इट्स लाइक इंसल्टिंग द डॉक्टर फ्रेटर्निटी. तो व्हाट
Hmm.
इज योर टेक ऑन दिस पार्ट?
So yeah, I think we friends also have had that discussion as to whether we are doctors, we are dentists. So in a typical culture, as you would say, the society feels doctor is somebody who treats your disease.
करेक्ट.
And to be honest, दांतों को कोई disease होती नहीं है सोसाइटी के हिसाब से.
हम्म.
दांतों में दर्द होता है और दर्द की दवा होती है.
हम्म.
सो डॉक्टर जो होता है वो अलग होता है, वो सर्दी खांसी ठीक करता है, वो दवाइयाँ देता है. एंड आई एम टॉकिंग फ्रॉम द पॉइंट ऑफ व्यू ऑफ 90s वेयर family doctors used to dispense medicine,
हम्म.
and that kind of a thing. Whereas dentist को तुम जाके अगर पूछो कि मुझे बुखार है, मुझे तो मैंने क्या करना चाहिए, and the dentist is not probably really going to put a stethoscope on you and really check, and not going to give you cure of that disease. Okay, so I think there is this delineation कि वो हमारा सर्दी खांसी नहीं ठीक कर सकते या दूसरी कोई भी चीज नहीं ठीक कर सकते. So they are not doctors. But if I have to really defend that, and I honestly don't feel the need to defend it, but जो PhD करते हैं वो भी डॉक्टर ही होते हैं, मतलब उनको भी. And why is that tag given? Because they have done a deep study in a certain topic, and they have submitted their theses, or they have done that much research, and that is why they give it a degree called as doctorate, where you are an expert of that particular subject. So I think the same goes for dentists also. In fact, we are मुझे ऐसा लगता है कि थोड़ा specialization हो जाता है कि दांत, मतलब to get into that specialization, you definitely have done that much of studying. And so I guess, yes, it is wise enough, or it is correct enough to call us also doctors. And that's my take on it, actually.
Right. This is the right approach. I should say that now it is, now that you have established yourself as a dentist, you just let that pass कि dentist को doctor नहीं बोले तो how much would you vehemently justify it? Because as a lawyer as well, right?
Yeah.
ये एक stereotype बनी जाता है कि हर lawyer, मतलब अगर पूरे इंडिया में हर साल अगर लाख लॉयर निकलते हैं, टेकिंग एन एग्जांपल, तो हर 1 लाख लॉयर इज स्टैंडिंग आउटसाइड कोर्ट फॉर वर्क. तो ये जो स्टीरियोटाइप है वो भी जब भी मैंने इनिशियली ज्वाइन किया था मेरा लॉ स्कूल, तभी मैं भी थोड़ा डिफेंड करता था कि नहीं ऐसा नहीं होता है, देयर आर डिफरेंट टाइप्स ऑफ लॉयर्स एंड ये एंड वो करके. बट नाउ दैट आई बिकम a lawyer, I have just given up explaining it. Like, but now whatever your perception is, you continue to be in that notion. I am not going to change that notion.
Exactly, and I honestly feel that some people do it for their sake of fun and to have fun at our expense, and sometimes I let them, it's good. I mean,
But yeah, all
अपना
in
क्या
good
जाता है,
sport.
ठीक है यार, हाँ यार ठीक ही है,
Yeah,
whatever, you know.
right. Now, Ajinkya, I've had this question since like a long time, like many years.
हाँ,
Toothpaste is something that we use regularly, right?
right,
सुबह शाम अगर कोई 3 बार भी ब्रश करता है तो probably 3 बार भी यूज करता होगा
correct.
toothpaste. But I have never gotten to know what is the history of toothpaste. Like, why was it invented? Where was it invented? Or how did it suddenly come to become a product जिसके बिना किसी को नहीं चलता है? So can you tell me what is the history of toothpaste?
So I'll tell you about toothpaste. Before that, you need to understand about toothbrush. Okay,
Okay.
so why did first of all people feel the need to brush their teeth? You
Hmm.
know, I think it came around. It came much so in the BC era, matlab, not even AD, but in the BC era.
Hmm.
Probably, I guess, when men became social,
Hmm.
and they realized that teeth are a part of their body. It is something that is visible, and again, I think probably while talking, or they realize there is odor coming out from their mouth, and that is the time, I guess, so tubelight jala hoga, okay, we need to
Hmm.
do something about our teeth. And that is
Hmm.
how the first toothbrush, probably the Chinese, it is said, so there's a debate again whether the Chinese invented it or the Greek invented it. But
Hmm.
the textbooks say that Chinese started with what we call today as miswak. Okay, the same
Okay.
thing, twig, datun jo hum bolte hain, the same
Hmm.
thing they used to chew on, and that was their toothbrush.
Okay.
So that is how they started, and that is the history of toothbrush. Over a
Hmm.
period of time, then it kept evolving into a lot many other things. Then came in the need for toothpaste, because probably the toothbrush, that twig was just not enough, and maybe it was not cleaning properly, or the taste was probably not good enough, or it was just not acceptable, or they felt that something more needs to be done.
Hmm.
And maybe again an era came where you were just not happy with clean teeth, you wanted whiter teeth. And
Hmm.
probably then came era of abrasive agents, actually. So the first abrasive agent, it is said that they used burnt bread, you know
Hmm.
burnt bread ka powder bana ke, they used to use it on their teeth as an abrasive agent,
Hmm.
for to not to clean their teeth, but it was majorly to whiten their teeth, assuming that this is going to whiten their teeth. And from there, I think the Greeks, again, the first toothpaste apparently was in Babylon, is if I'm honestly recollecting it
Hmm.
well, and if my memory is supporting me well enough, that is where I think the toothpaste came into picture. uh, and then eventually there were a lot of materials used, like the bone powder was used. uh,
Hmm.
then chalk started being used. Then there was a point where I think even limestone was used, chuna jo hum bolte hain. uh,
अच्छा.
you know, these things started coming into picture. And in fact, if you ask the local people, no, like if I go to my native, uh,
Hmm.
they have a thing of lemon peel and salt. They will
Hmm.
do that with lemon peel and salt. And even today in my native, they use chulha. So
Oh.
चूल्हे की राख से बर्तन भी घिसते हैं और दांत भी घिसते हैं. So
Hmm.
a lot of oldies still follow that, because they are probably used to it. you know
Hmm.
so these were a few ingredients that actually they started using. And I think somewhere in the 1800s, when the industrial era started, uh, they came up with the smoother version of toothpaste, the proper toothpaste that got refined today is, I think, around somewhere about 1870s or something like that. That's when the toothpaste came into picture. And
Right.
then obviously we are constantly evolving and adding more things to our toothpaste and to the inventory of toothpastes. I think that's an ongoing, I think it's going to keep going on.
Discovering.
We're going to keep, yeah, I honestly don't feel it's a discovery like charcoal, like Colgate charcoal for that example, or any charcoal toothpaste. I should not even be naming brands here, but charcoal toothpaste for that matter is actually a repackaging, okay,
Okay.
or any herbal toothpaste for that matter. It is it is science that Ayurveda knew probably long years back. Now we have suddenly found it, and suddenly it has become this fad, if you may say so. Ayurvedic products, and it has just come into limelight, and people are repackaging it so that their marketing and sales probably wants to take a hike. And I think that is what leads to so-called discovery of products. But मुझे ऐसा लगता है it's just repackaging. ऐसा नहीं था कि मेरे को पता नहीं था कि these are the things used earlier, सिर्फ these are just repackaged and remarketed very cleverly.
Right. I mean, coming from a dentist itself, के ये सब repackaging tactics है, I find it really weird to know as a customer as well. And I was going through a little bit of history before the recording of the episode, and toothpaste. I mean, apart from what you have just said, it was only in like the 1950s or 40s or 50s, around that time, when the chemical fluoride had become very
Yes.
main
Yes.
ingredient in the
Yes.
toothpaste. And what had
Yes.
happened is the marketing of that product was done in such a way that it had become a product of what should I say, a utility कि दांत क्लीन करने हैं, to a product of aesthetics, जहाँ पे where people will find you attractive only if you have white teeth
Right.
because of the fluoride involved. And I think वो जब ये tactic change किया ना, I don't remember which company had changed it, but it was certainly an American company. वो tactic जब ये change है, it is when people started realizing, and it's like a people had opened their eyes कि अच्छा मैं जब भी बात करता हूँ या करती हूँ, तो मेरे थोड़े भी दांत अगर दिखते हैं तो जितने भी दिखे वो अच्छे दिखने चाहिए, ना कि ऑफ वाइट दिखने चाहिए. So that is when
Absolutely.
it's kind of selling insecurity, I would say, कि people started to realize कि अच्छा अभी टूथपेस्ट यूज करते हैं करके.
Absolutely. I think, I don't know if you remember or if you know, there used to be this ad where this kid, there was a teacher and a kid in a classroom, and the teacher is teaching colors. And, I think she asks, what color are my teeth? And she's expecting an answer to be white. And the student says, off white, and
Okay.
she gets embarrassed. I think. I'm sure it must be the very well known brand, but yes, but that isn't that what all of us in some way or the other do. Mostly all brands highlight a problem, and then probably they want to make their product as a solution to it. And the same goes for fresh breath, again, because I think that is something tangible. It is something that, and to top it, it's more important. you know uh, it, we as a society, I think, looks, form, क्या बोलते हैं, form over function has always been given importance. So
Right.
how it looks is more important than how it really functions, and I guess that is where the whole game is
The
probably.
whole game has changed, right?
Yeah.
Then, according to you, how important is this chemical fluoride in toothpaste? Apart from
So
वो जो चारकोल वाला है, बिकॉज अभी तो क्या है कि बहुत सारे प्रोडक्ट्स में चारकोल वाला वेरिएंट आ गया है, वो फेस वॉश रहे, टूथपेस्ट रहे, कोई
right,
और भी प्रोडक्ट रहे, विच आई एम नॉट अवेयर ऑफ. बट ये चारकोल वाला तो कॉन्सेप्ट है कि हाँ, फिल्टर्स में भी आ गया है चारकोल प्यूरिफाइड, समथिंग लाइक दैट, राइट?
right,
तो इस
right.
तो ये दोनों प्रोडक्ट्स का कितना इंपॉर्टेंस है एक टूथपेस्ट में?
So we'll talk about fluoride and then I'll probably talk about charcoal, because I honestly did not do a lot of research about charcoal, because firstly, as an ingredient, charcoal is one of the most abrasive ingredients if you're going to use it in a very pure form. So if you want to use it on your skin for a moment, or somehow do something with it for your skin, it might be okay, but I'm not a dermat, so I won't be able to comment on it either. But for your teeth, definitely in its purest form, it is abrasive. Okay,
Acha.
it is a very hard substance to use on your teeth. Now, for example, if I have to give you example, you want to wash your hands and there are two soaps available. One is Vim bar, okay, जिससे हम बर्तन धोते हैं, and one is a Dettol hand wash. What are you going to prefer? You're going to prefer
Dettol.
Dettol hand wash because
Correct.
it's smoother. It is, and it is going to do the job that it is going to do. And for a matter of fact that Vim is going to be abrasive. It's going to be a hard thing, and you're not really going to enjoy that experience. So you're not going to use that. The same thing goes for your regular toothpaste and your charcoal based toothpaste. Now, I honestly don't know how much is really the amount of charcoal that they use, and the benefits of per se using charcoal in the toothpaste. So it probably is as good as any other toothpaste that you're going to use. That is one. Also, I'm sure it is a little more abrasive because I personally have never used. In fact, as a matter of fact, I try and use all the toothpaste that are available in the market so that I'm answerable to my patients as to which one is a better one or what to go for, or so on and so forth. Coming to fluoride, I think again somewhere in the US was the first one to actually introduce or talk about fluoridation. Let me talk about fluoridation a bit. Fluoride as a component, or in its particular form, is known to prevent decay. Okay, now there's a lot of mechanism of action. The decay causing organism ko wo inhibit karta hai, and so on and so forth. Now that's the science of it. But so they realized that if we add fluoride, okay, either to our toothpaste or to our water, okay, the body is going to absorb that fluoride and is going to protect the teeth, indirectly. Okay, that's what the whole idea was, and that's how water fluoridation started in US. So what is water fluoridation? In the community water, वहाँ पे जो normal tap water है या drinking water, where they added fluoride. Now, fluoride has to be released in a particular concentration. Okay, now if you actually read the back of your toothpaste, it will say not more than 1000 ppm of fluoride. Okay, what is 1000 ppm? 1000 parts per million of fluoride. It should not exceed that. And why should it not exceed? Is because if you have more of fluoride, it is also going to damage your teeth, your bones, so on and so forth. Okay, so fluoride has its protective component at a certain level. So they came up with water fluoridation, and why did they come up with water fluoridation? Is because they realized that as a society we are getting high on sugar. Our every single substance, even if you take a ketchup for that matter, contains a huge amount of sugar. Okay, and US realized that as a consumer we are consuming a lot of food that is more refined. Okay, and more sugar laden. बहुत सारा sugar उसमें हम जा रहे, like if you actually see the sodas that we, the aerated drinks, everything contains a lot of sugar. So they said, okay, we will fluoridate the water, and that should help. Okay, but over a period of time, when they started doing their research, whether the water fluoridation is actually helping or not helping, or so on and so forth, they realized that even if the water is fluoridated, the incidence of dental decay in children is still the same. In fact, it has grown. Okay, and water fluoridation could help it only to a certain extent. And what was causing a problem was, in fact, the diet. Okay, so fluoride as a component in the toothpaste is protective. Okay, but everything has to be in limit. So even if you're using a fluoridated toothpaste, but you are going high on your mithai and your sweets and your chocolates, you are bound to get cavities. Nobody's going to protect you from that happening, So just because you're using a fluoridated toothpaste is not end all of everything.
Hmm.
You got to take care of your teeth, and most important contributor in teeth decay is going to be your diet. You know,
Hmm.
the kind of food that you take.
Right. Right. Yeah, the sugar is a huge problem, and it's a problem that grows steadily, even
I'll
with.
tell you. Yeah, just sorry to interrupt. I'll tell you one thing that I was I heard in a TED talk that
Hmm.
uh, so they were doing this research again. I think it was an American. I think Harvard was no, not Harvard. In fact, there was this company in fact who was doing this research. They were finding out what is the cause of heart attacks, or
Hmm.
heart disease or obesity. Okay,
Hmm.
in fact, obesity is what I think they were researching. Okay, and they did their research, and the conclusion came that high fatty food substances and oily food stuff should not be eaten, and that is how the whole fad of fat free and skimmed milk and zero fat and no trans fat and all of that started getting that hype. But
Hmm.
a few years down the line, Harvard did a research on that research, and they realized, that the research that they did was absolutely wrong, or it was manipulated uh, for a certain section of the industry. And the biggest contributor to fat gain is actually sugar that we consume and not the fat. Okay, and this is a legit Harvard study that happened, and because and why it was hidden for so long is because sugar was being used in every single product, every single food product that you go for. If you actually
Hmm.
read the back label, you'll have the second or the third ingredient as sugar.
Hmm.
Even if you go for chips, even if they are salted, they will have sugar. uh, Ketchup, as I said, your bread, your biscuits, your salted biscuits, your pizza base or your pizza, again the sauces on top of that pizza, everything was sugar, laden with sugar. The other day, same thing, I think in the same TED talk, where she said, uh, when you're consuming a soda, two-third of it is sugar. Two-third of the volume is sugar, and that is, you don't realize it because to dilute that much of sugar, they're using the flavoring agent, and you don't realize it that you're having so much of sugar. And
Hmm.
the whole manipulation was to hide sugar as the main, you know cause. In fact, तो वहां पे वो उन लोग तो breakfast cereals भी वही खाते हैं ना, cornflakes, and that was also high on sugar. But that as an industry boomed because they marketed it as fat free and no fat or whatever, high fiber, and etc etc etc. So
Hmm.
that's how the whole so-called scam happened.
Happened, right? Yeah, the sugar. I'll tell you one personal incident as well. It was until 12th or second year of my BCom that I used to drink. I mean, there was a high consumption of sugar in my body. Even while drinking milk as a breakfast in the morning, I would add 2.5 or 3 spoons of sugar,
Hmm.
and it was only in second or third year towards that, and I realized, okay, oh, this is because again Google, right? So
Right,
somehow I came across this article how sugar is a steady death cause of steady
right,
death,
right.
and I was like, oh, bro, you need to cut this down. Okay, you
Yeah,
really need to cut this down. वो
right.
cut किया, and today I am at that conscious, with what I eat. Is that, see, cold drinks तो मैं कभी भी consume करता ही नहीं था. Okay,
Hmm.
barely कभी किया होगा. बर्गर्स मैं यहाँ आके स्टार्ट किया, बाकी मैकडोनल्ड्स में भी मैं कभी इंडिया में खाया नहीं
Hmm.
था.
Hmm.
जूसेस, यस, जो आर्टिफिशियल जूसेस होते हैं ना, वो भी यहाँ पे आके थोड़ा आदत लग गया, बट अगेन दैट
Hmm.
इज अगेन इन
Hmm.
चेक, नॉट टू मच इन
Right.
कंजम्पशन.
Hmm.
And otherwise, I don't see any other source of sugar consumption now. I have started to believe कि जो natural sugars होते हैं, which is an apple
Hmm.
or pears,
Right. Right.
watermelon, वही सब मैं बाद में consume करने लगा. So now my dental health is like in very good health. And whenever I visit a dentist, the first thing that he or she says is that, "Okay, as per your age, your dental health is really very good." So
Good,
that's a very proud moment for me as
good,
well.
good. So
Uh,
just to say, proving my point that diet does make a lot of difference in your dental health, apart from your overall health, definitely. But
mm,
yes, and this is what usually parents will come and tell me, that my child does not brush,
mm,
or my child does not, has a lot of cavities, and you will end up asking them, how does he have cavities, and they will say, pura din chocolate khata hai. And my next
mm,
question is, who is giving them chocolates? I mean, ठीक है, तुम्हें बर्थडे में मिल गए, तुम्हें स्कूल में मिल गए, तुम्हें कितना मिलेगा? एक या दो मिलेगा ना? From where are the kids getting? And eventually you'll realize that it's the family who's feeding them chocolates, and somewhere, again, and as you said, milk, adding additive in milk, आप तो sugar डाल रहे हो, यहाँ पे 2-2 चम्मच हम बोर्नवीटा डालते हैं, and that is nothing but sugar, right? And you
right.
are drinking it assuming it is healthy, but it is not, because it is sugar. It is completely sugar. Like, if you speak to a dietitian, maybe probably in your next podcast,
Mm,
you could speak to a dietitian, and I'm sure he or she would tell you that how harmful this whole game of milk powders, or what you call,
yeah.
health drinks are. What kind of and obviously, हम जब 90s, मतलब when we were kids, we used to feel Bonvita, and the taglines were fantastic.
Ha, completely.
Complan, ऊपर से Sachin doing boost, so everything added to it, and we were like, oh great, we are drinking the right thing. But now when you grow up, you realize, oh, that was so wrong.
Marketing, purely marketing.
Yeah,
Again, yes, since you brought this up about the cornflakes and जो Fruit Loops होते हैं, which people
right,
eat with milk. So one of my friends who is in US told me once, that the purpose of these Fruit Loops and everything wasn't to make a healthy breakfast to kids. The main purpose was because the milk is very boring to drink in standalone
right,
food.
right, right.
Adding this would really make it colorful and sweet, इसलिए the milk का भी consumption बढ़ जाएगा. But then
हाँ,
again the side effect was कि ये तो इतना sugar content वाला है, so that wouldn't add up clearly.
राइट. सो दैट इज व्हाट ना, हम एक चीज को इंटरेस्टिंग बनाने के लिए हम दूसरी ऐसी चीज डाल देते हैं,
Hmm.
which definitely makes it harmful anyway. मतलब सिर्फ दूध, again, there are so many substitutes available today, and not for milk. I mean, if you don't like milk, you can always have a cube of cheese, and it's, honestly speaking, it's not unhealthy. In fact,
Hmm.
cheese, for that matter, if you eat like probably a cube of cheese or a slice of cheese every day, it's good for your
Hmm.
teeth. you know so good for
Okay.
your teeth, your bones, etc. So
Hmm.
yeah.
Now, Ajinkya, in the beginning, you already shed some light on, the evolution of toothbrush. कि पहले हम वो
Right.
दातुन use करते थे, then
Hmm.
came the simpler toothpaste.
Hmm.
But now, even since obviously you are more aware about this than me, कि अभी the advancement of toothbrush has been such कि electric toothbrush है, वो soft bristles वाला, medium bristles वाला, hard bristles वाला toothbrush है.
Hmm.
So, is this only from a selling point of view ये इतने variety आ रहा है, या there is different purposes attached to it which I may not be aware of or general public may not be aware of, which you would like to tell?
So, see, one thing is that people feel that if they brush their teeth really hard, okay, or with a hard brush, okay, their teeth are going to get whiter. Because that's what my patients come and tell me कि मैं तो 2 बार brush करता हूँ, लेकिन मेरे teeth yellow के yellow ही है. Now there's a
Hmm.
reason why your teeth are yellow, is because there are 3 layers to the teeth, and the second layer, that is the middle layer, is the one that is giving color to your teeth, and inherently it is yellow. Inherently it is yellow. मतलब उसका
Hmm.
nature ही yellow है. Okay,
अच्छा.
and जो first layer है वो translucent होता है. Now it could be more translucent, or less translucent. If it is less translucent, your teeth might appear whiter.
Hmm.
And if it's more translucent, your teeth are going to appear yellow, because they're going to reflect off the shade that is there in the middle layer.
Hmm.
Okay, and that's what it is. But people feel that if I brush very hard, okay, my teeth are going to get whiter, and that is how they end up using hard bristle brush. But in the bargain, what they don't realize is, when they use a hard bristle brush, they are taking the enamel off. So enamel is the first layer of the tooth. They are actually abrading that layer. उन लोग वो layer निकाल रहे हैं, ठीक है? And your teeth eventually end up becoming more yellower if you use a hard bristle brush. So the soft bristle brush definitely do the cleaning action. They are gentle on your teeth, but I have known people कि उनको force इतना लगाने की आदत हो गई है ना कि उनके soft bristles के brush 15 दिन में ही वो ऐसे हो जाते हैं that they have to change the brush. Then they come and say कि अरे ये soft bristles का तो कुछ काम का ही नहीं है because it's not, I don't feel clean with this. You will not feel clean because you are used to now, brushing your teeth like you're scrubbing tiles of your washroom. तुम इतने जोर से तो उसको ब्रश कर रहे हो तो तुम्हें कैसे आदत उसको ऐसे लगेगा कि नहीं मेरा ब्रशिंग हो रहा है, and 70% of the people are brushing. In fact 80% भी बोलूं तो भी गलत नहीं है. 80% of people are brushing their teeth in a very wrong manner. We brush sideways and we do more of an elbow action, but it's more of a wrist movement, or you actually just go circular on your teeth, and that's how you're supposed to clean your teeth, and not
rub it like
people. Yeah, and I have seen people going crazy on their teeth, like 8-10 मिनट तक उन लोग का वही चालू रहता है.
Oh my god.
And I have known of people who chew on their toothbrush also as time pass ke jab tak chalo. I have known people, I mean my cousins sometimes, or I have seen people in the hostel chewing on their toothbrush ke haan chalo time pass ho raha hai, but probably that's a different kind of a thing only. But yeah, I have seen people also going total berserk on their teeth, crazy on their teeth.
I can confirm this because my uncle is that kind of a brusher who uses hard bristle. Plus, he rubs his teeth very hardly, and it's been like, I think we have pointed it out to him कि इतना जोर से करने का जरूरत नहीं है. Either if you want to have a preference for hard bristle, then use a soft hand, and if you have a soft bristle, then use a little bit of harder hand. But वो जो अभी क्या बोलते हैं, old habits are hard to break, right? So those things don't die easily.
Yeah.
And what is the purpose of the electric brush then?
So electric brush also is as good as your manual brush only. ऐसा नहीं है कि कुछ I wouldn't say that they are doing it only for marketing. ये marketing वाला brush है. But when they did the research, they said both clean equally. Okay, ऐसा नहीं कि powered brushes clean better और manual brushes से cleaning अच्छा नहीं होता है. But you could say powered brushes are slightly for the lazier people, ऐसा आप बोल सकते हो, because there's not really, you don't even have to move probably your elbow, bristles, wrist. तुम ऐसे रखो and majority of action is being done by the power itself. So जो तुम ये कर रहे हो या तुम ये circular घुमा रहे हो, वो मोटर अपने आप कर रहा है, तुमको खुद को कुछ करना नहीं पड़ रहा है. So it's more of a just making sure that you're putting gentle pressure दे रहे हो, and slightly more effective, and also there is a novelty. I mean, if you buy electric brush, you're going to be a little more incentivized. Not really rich maybe, but incentivized to use the brush. At least initial few days you're going to be like, chal aaj 2 baar brush karenge because I have an electric brush. It's like that when you buy a new thing and absolutely novel. That's one incentive, because I've used both. Yes, but in the electric brush now there are too many varieties coming which I feel are absolutely not necessary. Now a company has come up with a power brush which will sync via Bluetooth with your mobile app. There will be an app in the mobile also. Okay, and it will tell you, first of all, it will have a timer. So after timer is done, it will buzz. इतना time हो गया, अभी इससे ज़्यादा brush नहीं करना है तुमको. Okay, and it will tell you which areas you didn't clean. Okay, so it will. So if you have forgotten the inside of cleaning the inside of the teeth, it will, after your brushing is done, it will tell you that you did not clean this area of your teeth. And also I think it has a small LED screen which can change colors and stuff like that. And let me tell you, the cost of that toothbrush is a mind-boggling 17,000 rupees.
My
So,
God.
so when I heard it, I said, I don't know who's going to buy your toothbrush, but it's way too expensive because I think और थोड़े पैसे डालेंगे लोगों के पास एक नया मोबाइल आ जाएगा. They are
Correct.
not going to they're not going to put that much money on their toothbrush for that matter of fact. They might, for all you know, they might say मैं इससे अच्छा एक आदमी रख लूंगा जो मेरे दांत ब्रश करेगा, मैं उसको वो पैसे दे दूंगा.
Oh, यार, wow. Yeah, makes sense.
Yeah,
किसी का घर तो चल जाएगा उससे.
I know, right?
Right.
So there are some innovations which are not really needed. Uh,
Hmm.
some innovations are useful, some innovations are just purely
Hmm.
adding to the noise, to be honest.
Right. And this toothbrush that you talked about, is it
Hmm.
available in regular pharmacies या उसका कुछ startup जैसा है, only website से order होता है उनके वैसा कुछ?
Nahi, so they are, in fact, so I asked him the same question that, so he said we are going to launch it in the market soon, but currently for the dentists, we are giving it to dentists so that dentists can promote it and sell it to the patients. I said, see, please don't expect that from me because I'm not going to tell I'm not going to tell my patients to buy a 17,000 toothbrush because my patient is really going to either run away or going to be telling me, "Okay, boss, you're just suggesting me something wrong if I tell them
Correct.
to buy this." So I said, please don't expect me to sell this for you. That's not happening. So it's not yet in the market, but I think they're planning to launch it pretty soon. And I gave them a feedback, boss. I think only the Adanis and the Ambanis are going to probably buy your toothbrush. It's not for us.
Right.
Because it was a little crazy because I feel there's too much technology getting into our daily lives for no reason. I mean, sometimes I really feel that. I mean, there's no reason for the mobile to be around my toothbrush area. To be honest, I mean, I don't want my app to know how much did I brush and where did I brush and where did I not brush. It's just plain. I mean, and you're going to eventually, if you're going to be so reliant on technology, you're going to become super super lazy because I think that's what happened with Google Maps also. We have stopped talking to people asking for directions. We have पहले कैसे पान पट्टी पे जाके पूछ लो किधर है, अभी तो हम नहीं करते वो because Google tells you
Google
everything.
Maps.
So I
Right.
think we eventually become too reliant and too lazy after a point of time.
Ajinkya, I have a few more last questions on personal
Sure,
dental health.
sure.
And then we moved on to a different segment. तो
Sure.
अभी I'll tell my personal experience. Okay, जब पहले मैं ब्रश करता था ना, छोटा था तभी, तो क्या होता था, जितना भी वो जो क्या बोलते हैं उससे ब्रिसल्स का जो लेंथ होता था ना, उसके पूरे में लेंथ पे टूथपेस्ट डालता था. ओके, बट देन आफ्टर फ्यू इयर्स आई रियलाइज, आई डोंट नो, मैंने कोई यूट्यूब वीडियो देखा होगा या कहीं पे पढ़ा होगा कि एन आइडियल क्वांटिटी ऑफ टूथपेस्ट इज इक्विवेलेंट ऑफ अ पीनट. तो एक इतना डालो तो उतना चल जाएगा. So according to you, what is the right thing to do and what is the right
Yes,
quantity?
that is the right for children. So they say for children when you're using it, you're supposed to use the quantity of a single rice grain. That much
Oh,
paste when you're using it for children. And for adults, it's the size of a pea of a batan.
okay.
That much is the quantity that you're ideally supposed to use. वो तो टूथपेस्ट मार्केटिंग में उन लोग बताते हैं कि ये पूरा लगा दो इतना थिक and or obviously because that is something they want people to consume eventually. So और उनको तो पता है इंडियंस तो ऐसे निचोड़ निचोड़ के यूज करते हैं, but it's not just an Indian thing. Even the foreign ads, you'll see that they put it all over the toothbrush, but that's not the right quantity. It's always a small quantity and it still does the job. And again, there is this probably it's not mentality. I wouldn't call it mentality, but when a toothpaste foams, मतलब उसमें foam बहुत निकले तो it is doing a lot of cleaning action. But again, that's wrong. So a lot of time when you put more, obviously it's going to foam more. तो उनको लगता है कि cleaning ज़्यादा होता है. So a lot of people eventually end up putting a lot more, even if you tell them कि उतना pea size ही, and this information they don't write on the tooth boxes or anywhere. It is just something that you learn either from Google or from a dentist, or they will tell you कि इतना ही यूज करना है, उससे ज्यादा यूज करके कोई मतलब नहीं. So that's the right quantity of toothpaste to be used.
Correct. And what is the ideal how many times should a person brush teeth?
So ideally 2 times a day, definitely. By the textbook, this is what the textbook is going to tell you. Brush twice a day, and everything. Uh, but what I would recommend is that if you have had something like super sticky, like you have had, for example, caramel chocolate, okay, uh, try and make sure that you're brushing your teeth. Now, let's say, but you have had it in the afternoon and you're in the office and you can't do anything about it. You're not carrying a brush with you. कि मैं अभी जाके washroom में जाके brush कर लूं, but make sure you're at least rinsing your mouth and trying to get rid of that caramel as much as possible so that it's not stuck to the teeth. But yeah, to answer your question, 2 times, twice a day, ideally brushing करना चाहिए. There is no harm if you do it 3 times a day. But honestly, I don't think so anybody really has the time to do it. I do have patients who say, okay, we brush after every meal. But of late, what I have read is that if you brush immediately after eating, that's also not good, because that is a time when some acid production is happening. And if you brush, that is going to damage your teeth. So, try to take a 10-15 minute gap and then brush your teeth. But yes, after every meal, make sure at least rinsing your mouth is happening. And nighttime, make sure you're brushing your teeth. And in the morning brush for me personally is very, very important. Okay. Nighttime brushing, I mean, this might be a very unpopular opinion. Okay. Let's say you have not eaten anything. Okay. You have not had your dinner. And you have not eaten anything sticky or anything of that sort. It's okay if you don't brush, but it's not okay if you don't rinse. Make sure that you are rinsing and sleeping. Okay. But morning time brush becomes absolutely essential, because it's the entire night that has gone by and you have not brushed. Yes. But if you have brushed in the night, probably it's absolutely okay. So yeah, brushing twice a day. Yeah.
Twice a day is ideal, right?
Yeah.
That brings me to another question कि अपने इंडिया में ये हम लोग ने देखा है कि अपनी ट्रेंड क्या चलता है, द टंग क्लीनिंग वाला ट्रेंड है, राइट? और अभी वही में हम अपनी सीरीज में देखा ही होगा आपने भी कि वहां पे वो फ्लॉस वाला ट्रेंड चलता है. तो ये दोनों में डिफरेंस क्या है और किसको क्या सूट करता है?
I'll tell you. Okay. So two different things. Flossing is an absolutely different thing. Flossing is done for your teeth. Okay. Flossing is not done for your tongue. Tongue cleaning is, as the name suggests, it's for your tongue. Now the question is, why do we clean our tongue? Okay. I'll tell you, bad breath ka one majority cause is your tongue. Okay. One of the major factors are your tongue, your gums. Okay. And obviously all the tartar sticking onto your teeth. Now tongue is ऐसे आपको smooth लगेगी, but microscopically या उसका texture जो है, that's very rough. Okay. And it has different textures all throughout. Okay. And that is the place where, in that rough surface, where all the bacteria are residing and all the food also gets stuck. Okay. It remains, a layer of food remains. Now bacteria is acting on that food and it is producing volatile compounds. Okay. Or volatile fumes. Agar aapko usko fumes bhi is a wrong word again, but volatile gases or volatile products, which is giving that bad breath. Okay. So tongue cleaning, okay, is going to, when you scrape your tongue, that keeps that area clean. Okay. And it prevents bad breath because you have disturbed that colony of bacteria. That, okay, that is basically what is tongue cleaning. So make sure, yeah, tongue cleaning definitely helps.
ओके. तो ये हम फ्लॉसिंग क्यों इंडिया में फॉलो नहीं करते?
Laziness. I think laziness, and people are always on the run, I feel. When एक तो सबसे पहला floss is a very urban concept. I don't think so in rural areas anybody even knows what is flossing. Okay, अगर मैं किसी को tier 3 city में जाके पूछूंगा कि do you floss, I don't think so they floss. They would know what a floss is. So floss is basically it is a waxed thread. Okay, एक thread होता है, synthetic thread होता है जिसके ऊपर wax की coating होती है. ठीक है. Now we tie that on both our fingers and put it between the two teeth where the contact is tight. Okay. दो दांतों के बीच में. Okay. to remove whatever is stuck between the two teeth. Okay, now either it could be a thin food material, or it could be plaque that is assigned or accumulated. Okay, plaque that is accumulated. So what you do is you put that between your teeth and you just gently just do a swiping action and pull it out. Okay, also the wax on that thread gets stuck onto your teeth and creates a small layer where things are not getting stuck back again, but obviously it stays for a few hours and then you're back to the same thing. But floss is basically used to clean areas where your bristles of the brush are not able to reach.
Okay.
Yes, आपके bristles दो दांतों के बीच में तो नहीं जा सकते हैं, right? So this is where the floss comes in place, and floss is definitely helpful if you do flossing. Initially, you will face a lot of discomfort कि अरे यार ये पीछे के दांत को मैं कैसे करूँ, ये कैसे करूँ, ये नहीं जम रहा है. But once you get a hang of it, it becomes quick and easy. But वो initial few जो रहते हैं ना days where you are not used to it, you have not got a hang of it, तो वो थोड़ा difficult लगता है. If you are through those first initial few days, then you will stick on to that habit. But if you're not, then फिर वो नहीं होता कभी किसी से. और again, to answer your question, why do we not do it or why it is not done in India is, one is lack of awareness. Okay, I wouldn't say laziness is one major cause, but lack of awareness is one. Okay, like even if I ask a lot of my patients, do you floss? First of all, they'll have a big question mark on their face because they don't know what is a floss. Okay, they have never used one, they have never been suggested one. There are no ads for flossing again, as much as we have it for toothbrushes and toothpaste. So lack of awareness. And once, even if you tell them, like all other dental instructions, this instruction is also not for a toss. So I think dental instructions are just like parents' instructions. You hear it from here and it goes out of here. I think there's a very good meme on it. Dentists are just like your parents. They don't judge your life; they just judge your teeth. Something of that sort. Only thing is that they judge your teeth. Something of that sort. So, yeah.
So is toothpick a substitute for flossing? Because यहाँ पे restaurants और ये सब में तो हमने देखा है कि वो लोग toothpick देते हैं.
No. Toothpick are in fact the most harmful things that you can actually introduce to your teeth. Because see, first of all, most toothpick are made out of wood. Okay. So what happens is when you put a wooden thing inside, okay, for that matter, if you even put matchstick, small splinters, okay, can get stuck. Okay, वो कभी निकल के small splinter ऐसे अटक गया अंदर. ठीक है. Sometimes I have had people who have tried to remove something and a toothpick broke inside. Okay, right? So that is a problem. Second problem, toothpick is very pointed. So what you're doing basically is actually, तुम्हें तो नहीं दिख रहा ना कि वो किधर जा रही है. But what you're doing is when you're introducing it, you're actually injuring your gums. That relief you will get कि वो खाना निकल गया, but in the bargain you have also injured your gums. There's a substitute for toothpick and a much better substitute that is called as interdental brushes, which are just like toothpicks, but they have soft bristles on their handle or that cleanable area, and that gives you a good way to clean between those two teeth. Also, if food is getting stuck, there is something wrong with your teeth or your gums, which means either you have a cavity or you have a huge gap between your teeth where the food is going and getting stuck. Now the gap is either the cavity or your gums have receded, they have gone down, and it has created a gap where the food is going and getting stuck. So rather than using a toothpick, find out why there is food getting stuck, okay, and why is it such a recurrent problem, and get that solved rather than using a toothpick and getting done with it, because that would be a temporary solution but a long-term damage.
Right, these things that you told, right, was the things with small bristles. My brother uses that because he has been taking this what do you call that, braces wala treatment. Braces. So a doctor has recommended, so that is how I know about it. Right now, Ajinkya, we have already discussed a lot about personal dental health and everything. but
Right.
there are some things that the dentist industry is aware, but we are not aware of. So my
Hmm.
first question is, in the beginning of the conversation you told me you are a general
Hmm.
dentist, general dentist.
Hmm.
So what are the types of dentists that are existing?
Oh yes. So dentistry per se is a 4 year plus 1 year internship course. Okay.
Hmm.
Once you have done that, then you are free to practice general dentistry. Okay. Like all other specialities, like medicine जैसे आप कर लोगे तो MBBS की degree मिलेगी. But if you want to
Hmm.
specialize, then there are a lot more things like cardiology is there, ENT is there, so on and so forth. The same way, dentistry has about 7 fields. Okay, first comes, I mean, there's no particular sequence, but as I remember, I'll tell you.
Hmm.
Orthodontics, which is uh, for layman, it is braces, but it is
Hmm.
much more deeper. If you have skeletal deformity of your face, okay, that could, I mean, if you have malalignment, which is because of a skeletal deformity, the orthodontist, along with the oral surgeon, can also help you correct that. So orthodontics is one. Then is periodontics. So perio comes from the word peri. Peri means periphery of the tooth. Okay, so periphery of the tooth is bone and gums. So periodontics is, bone, gums, and tongue also. Okay, so gum
Hmm.
health, bone health of the jaw again comes in periodontics. Then prosthodontics. Prosthodontics is prosto comes from prosthetics. So prosthetics is when you put something artificial, like a artificial limb, that is a prosthetic. So similarly, if you put an
Hmm.
artificial tooth, so somebody who specializes in putting artificial teeth, dentures, implants, any kind of artificial fixture on your face for that matter would come under
Hmm.
prosthodontics. So I know a lot of prosthodontics who have done a little super specialization and have gone for reconstructive prosthodontics. So let's say somebody is affected by cancer, okay,
Hmm.
and we have had his whole jaw removed, okay.
Okay.
So they will give you a complete jaw replacement, artificial जो बाहर से आपको एकदम नॉर्मल लगे और वो अंदर भी, या तो फिर किसी का पैलेट में कैंसर हो गया है तो पैलेट को रिकंस्ट्रक्ट करना है या प्रोस्थेटिक देना है, सो दैट इज प्रोस्थोडोंटिक्स. Okay, then
Hmm.
there is pediatric dentistry, which is dentistry for children. Okay,
Hmm.
जैसे pediatrician होता है वैसे pediatric dentist होता है. uh,
Hmm.
then there is oral surgery, okay, which is again surgery of the oral, neck, and maxillofacial region. Oral surgeons, to start with, they do any kind of oral surgery within the mouth. Wisdom teeth removal, a general dentist can also do, but specialization, oral surgery, like if it's very
Hmm.
difficult case, the oral surgeon takes it. Trauma cases like a road traffic accident has happened, and something has happened to the face, or there's a facial fracture, your jawbone has fractured, then again the oral surgeon comes into picture. Apart from that, they also treat oral cancers. uh, so uh, so
These are
अगर
the
नहीं, there are
huh.
more, but to talk about oral surgeons, like for me on a personal level, uh,
Hmm.
high regard for oral surgeon, because there's a lot that goes into, we feel that it's just the face, but we are actually closest to the brain, and to handle this whole apparatus of the jaw and the mouth, it's a very you need skill, you need skill. So I have high regards for oral surgeon. So
Hmm.
oral surgeon, then, so that makes it what, five? We spoke about five, I think.
Hmm.
Then comes oral radiology. So ओरल रेडियोलॉजी इज जैसे हमारे रेडियोलॉजिस्ट होते हैं जो एक्सरेज और ये सब का इंटरप्रिटेशन करते हैं. ओके,
Hmm.
सो एक्सरे ले लिया, सीबीसीटी स्कैन्स, सीटी स्कैन्स, एमआरआईज, सो इन सबको रीड करके you come to a diagnosis, that is oral radiology. Then
Hmm.
there is something called as OMDR, which is oral medicine diagnosis. Same thing as oral radiology के साथ ही oral medicine diagnosis and radiology. So this is
Hmm.
one branch in itself. And then there is something called as oral pathology. Oral pathology जैसे अपने blood test वाले होते हैं. So they, जैसे radiologist X-ray देखकर बताते हैं, इन लोग specimens देख के बताते हैं. Specimen मतलब अभी for example somebody has a tumor. Okay, so that
Hmm.
tumor is surgically removed. फिर उसको माइक्रोस्कोप के अंदर देखते हैं कि कौन से टाइप का ट्यूमर है. so the pathologic study of those
Mm-hmm.
diseases. So these are actually kind of, oral pathology is actually more so, you can say, kind of non-clinical, where you're not directly seeing the patient. It's more of a lab oriented job, but it's nonetheless, it's a complete master's degree in itself and absolutely respected again,
Mm-hmm.
oral pathology. And there's a new branch of dentistry, not very new, but yeah, relatively new, which is called as community dentistry. So community dentistry is uh, it's like a lot of research work as to how communities oral health is doing, whether their डीके का रेट बढ़ रहा है कि नहीं, गम हेल्थ कैसा है कम्युनिटी में, so on and so
So
forth.
it's more theory rather than
More
operating
theoretical.
on.
Again, it's a very non-clinical,
Hmm.
part. And a lot of dentists these days consider another specialty, but academically yet we are not separated. Is implants dentistry or
Hmm.
implantology, which comes under, a lot of, like, oral surgery also will take implantology. Prosthodontics will also take implantology. Again, some part of orthodontics also do a different kind of implant. Then
Hmm.
again, we have the periodontists doing implants. So again,
Hmm.
implantology is very much, but again, it's general dentists also do implants. So
Hmm. Right.
that is one
Right.
thing that probably.
I want to ask to make it clear for myself.
Yeah.
Okay, the one type of dentistry that you talked about was to the tumor care related, right?
Right.
So how does that function? Okay, with the help of that teeth X-ray of the teeth, you get to know whether the person has tumor or not. ऐसा कुछ होता है?
I'll tell you. But before that, I forgot one more specialty, and I think the endodontists will kill me if I don't mention their specialty, and that is endodontics. Endo
हाँ.
means inside. So what is inside the tooth? Inside the tooth is the pulp of the teeth, which is the
Hmm.
nerves and the blood vessels. So root canal specialists are endodontists. Also, they
Hmm.
have, I mean, they are trained in certain surgical skills for a few, procedures. So these are
Hmm.
endodontists. And forgive me, my endodontist friends, because I completely missed out on that. So excuse me for that. Yeah. So coming back to your question, will X-rays tell me whether that tumor is there or no? So there are lot different kind of tumors. Okay. Some tumors will show up on the X-ray, while some won't. Like typically, which are on the soft tissue side. Like if there's a tumor in the cheek or in the tongue, it's not going to show me on the X-ray. It's going to show me either on an MRI or a CT scan.
Hmm.
Okay, so X-ray पे ही नहीं पता चलेगा, but then you have other modalities. Also clinically, also I will know most of the times if there is a tumor or there is a cancer. I will know, but to make a specific diagnosis, I would need pathology reports or radiology reports to say, yes, okay, this is a kind of a tumor or a cancer, or so on and so
Hmm.
forth.
Right. Okay. ये पहले के ज़माने में यू मस्ट हैव नोटिस एज़ वेल कि जिनका टूट गया होता था ना परमानेंट टीथ, तो उनको वो सोने का कॉपर का या वो डाल के देते थे सिल्वर का। तो वो क्यों डालते थे? कि वाज़ इट बिकॉज़ द लैक ऑफ टेक्नोलॉजी के वैसा एस्थेटिकली गुड लुकिंग टीथ वो टाइम पे आया नहीं था या उसका कोई और साइंटिफिक रीज़न था?
So I've honestly not heard of copper teeth. I have heard of gold teeth and I have heard of silver teeth.
Yeah. Hmm.
Copper, I have honestly speaking not heard, but we'll come to the technological part. But let me answer your question. Yes, because there was, the technology was not developed to give you a aesthetic feeling. Let me
Hmm.
put a point in example. बोलते हैं ना दांतों में चांदी भरना है.
Hmm.
Okay, so it was not only chandi, okay, but it was an alloy again, which is made by mixing mercury. Matlab, there used to be silver powder, and it is not just silver powder. There are other, like there was copper in it, there was zinc in it, there was lead in it, so on and so forth. Okay, so a few things mixed and then mixed with mercury, made into a cement like consistency and packed into your teeth. Okay,
Hmm.
now first it had mercury. Over a period of time, when research happened more and more, they realized mercury is not really good for your teeth or
He-
good for your body, in
Health
fact, for that
itself.
matter of fact, health itself. So they came up with something called as tooth colored fillings, which are called as composites. And these are tooth colored. So if you actually get them filled, you'll not even know that people have a filling done unless you see an X-ray. Then you would know. So to again answer your question, better technology was not available. Better materials were not researched, okay, and implemented. See, research is in dentistry at least is something that goes on for a long time for it to actually come into the market and see, okay, this is a viable product because it is something going into the mouth, then the FDA has to approve it, and then it comes out, and there's a huge, there's a whole process to it. So better materials were not available, and aesthetic materials were not available. So that is why these gold, silver, and let me tell you, these are not real gold or real silver. Not that you cannot make real gold or real silver, but strength wise or function wise, they might not be as good for your teeth. And again, they are Japanese gold. So jo textbook mein bolte the, definitely there was some component of gold in it, but it was not like 99% khara sona. So
Okay, it was a lack of technological.
lack of, let's say, lack of better materials rather than lack of technology. Probably lack of better materials, and better materials were not researched and not verified whether this can be used in the mouth.
Ajinkya, dental health is so important that you know it's something that we haven't been taking seriously, although it is important now, because you even as a dentist, जैसा ये आपने ही बताया कि एक कान से सुनते हैं दूसरे कान से निकाल देते हैं, तो ये इतना नेग्लेक्ट क्यों है डेंटल हेल्थ को लेके इंडिया में? ऐसा क्यों नहीं कि we treat it as good as we treat any other part of the body?
Okay, let me ask you this. Okay, if you had 10 eyes, okay, would you not be थोड़ा सा careless about चल यार एक हाथ निकल भी गया तो भी क्या फर्क पड़ता है? So imagine having 32 of those, and you feel कि चल नहीं चला गया तो क्या ही फर्क पड़ेगा. But what people are not aware of is that each tooth has a different function. Okay, and if you ever get to talk to your grandparents who have probably lost their teeth, okay, just ask them what are they missing on, and I'm sure they would tell you, they might tell you that they are enjoying, they are eating everything, but really ask them if they are getting that satisfaction of chewing. So each tooth has a different function. Okay, each tooth has a different shape. So like from your front teeth, they are called as incisors, which means they are more for biting, okay, and not for chewing. Okay, the back teeth are again for grinding your food and making it finer. That is the whole reason for your molars. Okay, and same way, it's not just eating. Imagine you losing your front 4 teeth. You'll not be able to speak so many words because air is just going to pass through it. Okay, so this is importance of teeth, but people don't realize it till they have lost their teeth. Like I know a lot of mothers, in fact, coming to me and saying कि अरे हमने तब ध्यान रखा होता तो हमें पता होता, तब पता चलता. अभी तो हम हमारे बच्चों को बोलते हैं कि अपने दांतों का ध्यान रखो, so on and so forth. I think it basically stems from the fact that you have too many of them and you don't really bother for it. That is one. Also, initial stages of dental decay or are painless. It's just a black spot on the tooth which you're not really bothered about. It goes deeper and you initially have some sensitivity which eventually might just die down, or you ignore, or you are absolutely brave enough to bear it. But when it starts paining unbearably is the time when I go to the dentist, because boss, now it's not letting me sleep. That is the time I will go to the dentist. But by that time, I'm in a situation where I cannot really help you a lot. I'll have to do either a root canal or get your tooth out. So it is because first, there are too many. I mean, I have 32 teeth or I have 28 teeth, or ek chala gaya to kya hi farak padta hai. That kind of issue is there. That is one thing. Secondly, I think it comes from the fact that it is दोनों चीज है, मतलब एक तो डर के वजह से भी नहीं आते लोग कि बहुत पेन होगा. I think that is one thing. People don't come to the dentist, or they neglect pain even if they have it because they have fear. The third thing could be because पेन नहीं हो रहा है तो मैं डेंटिस्ट के पास क्यों जाऊं. Okay. And fourth is, I think there is also in India uh, expense involved. I mean, expense सब जगह होता है, but they feel that dentistry is expensive, and that is why I will not come, or I will not go to the dentist, and I will let it pass on, kind of thing.
Correct.
ऐसे. Yeah.
ये जो the aesthetics about the teeth, right? If you have noticed, if you are active on Instagram, आपको एक बार कुछ बार दिखा होगा एक मीम. एक फैमिली होगा, उसमें एक आदमी का दोनों आईब्रोज नहीं है, ठीक है, पर उसका एक दांत नहीं है, तो फर्स्ट ऑडियंस सबने उसके दांत पे गया. तो इट्स अ वेरी फनी वे टू पॉइंट आउट कि देखो दांत का ही इम्पोर्टेंस है. बट पीपल क्या बोलते हैं, मीम्स को सीरियसली लेता कौन है. हमने हंस दिया, वी हैड अ गुड टाइम, तो जाने देते हैं. बट देन यू डोंट थिंक अबाउट कि हाँ यार, अगर मेरा भी दांत टूट गया ऊपर का, तो ऐसा मैं कैसा दिखूंगा करके.
So that is, in fact, that is the part, so in BNI again we get a chance to talk about our business, and one day that is what I did. I took photos of a few celebrities with their teeth removed. I mean, I had, matlab, Photoshop images are actually available. Like if you type a celebrity name and say toothless, and you'll get, I mean, you'll have presidents of countries jinka daant nikala hua hai. So I took those photos and I said, will this celebrity be a celebrity if with a smile like this, and that is when it hits them. Okay, but to take action on that impact is, ठीक है यार, देखेंगे जब होगा तब देख लेंगे, that kind of a thing. Also, again, coming back to the previous question, if I have bad breath, okay, I can experience it, okay, or maybe I cannot, unless somebody will come and point it out, okay. But who actually does go and point out, even to your best friend, that boss, your mouth is stinking, why don't you go and get a cleaning done, because you're going to lose friendship, you're probably going to be hit back, or you don't want to put your friend into an embarrassing position, and that's why you're not going to tell it. So वो जब तक खुद को experience नहीं होता है, so out of 10 patients, for example, probably one patient will come and tell me, okay, I have a bad breath issue, or people have told me I have a bad breath issue. So, and that is why I think a lot of neglect is also there, that people don't know how bad their teeth are, and for a lot of people, again, it's lack of awareness. उनको लगता है ये normal है, उनको लगता है दांतों के ऊपर जो ये येलो लेयर है वो नॉर्मल है, वो सबको होता है क्योंकि सबके दांत वैसे ही दिख रहे हैं. सो वो इसको भी है, मेरे को भी है, तो ठीक है, नॉर्मल ही. अगर सबको है मतलब इट्स नॉर्मल ना. इंडिया में तो, इंडिया में वैसे ही होता है कि ये चीज तो नॉर्मल है, सबको होती है, एंड इट इज समथिंग कि वो आएगा जाएगा, तो ठीक है, ब्रश कर लेंगे हो जाएगा, बट इट डजंट. एंड people end up coming at stage where we are not really able to help them to our best ability.
Can I add to this point? I mean, this is very intense to tell. We as a nation, right? हम लोग वैसे लोग नहीं है जो किसी को criticism सीधा करे, right? I'll give an example. Right in the beginning of the podcast, I mean, before we started recording, you asked me, is this suit fine? Now I really mean that it is fine, इसलिए मैंने बोला fine. Right. But most of the time people say fine because you are an authority over here. आप मेरे से 10-12 साल बड़े हो, तो I cannot point out कि you are not looking good and everything. Number one, okay, तो that is the way we don't point out. And number two क्या है, ठीक है, मैं देखो ये थोड़ा intimate बात है कि लोग ये bad breath जैसा जो health होता है, okay, now I don't have this problem, but I'm telling you this कि unless they find a girl, right, where they have a chance to make out, or where the girl points out कि भाई तेरा bad breath है, that is why I cannot kiss you.
Right.
तो तब तक वो लोगों की आंख खुलती नहीं है कि
Hmm.
अरे ऐसा प्रॉब्लम है करके. सेम थिंग विथ ब्लैकहेड्स और यूनिब्राउज. लाइक दीज आर द वेरी टाइनीस्ट
Right.
थिंग दैट वी डोंट डिस्कस, कि हम लोग
Right.
जाने देते हैं. इट इज नॉट,
Hmm.
इट इज क्या बोलते हो, इनर ब्यूटी दैट मैटर्स, नॉट द आउटर
हाँ
ब्यूटी, वो वाले
हाँ
कॉन्सेप्ट पे. बट
हाँ,
इट्स, ये चीजें मैटर करती है, राइट?
इट
एंड आई
करती
थिंक
है।
some people get offended. अगर समझ लो मेरी कोई गर्लफ्रेंड होती है, you know,
हम्म,
she must have told कि मनन you have bad breath, तो
हम्म,
वो मुझे काफी, वो क्या, ईगो पे आ जाता है कि लड़की ने
ईगो पे।
कैसे बोल दिया फर्स्ट
हाँ
ऑफ ऑल,
हाँ
कि
हाँ हाँ
मैं उसका बॉयफ्रेंड हूँ ना, मेरे को
हाँ
ऐसे बोल दिया,
हाँ
जस्ट एक्सेप्ट
हाँ
हुआ है. तो
हाँ
जब
हाँ
तक वैसे प्रॉब्लम नहीं आता ना, तब तक
हाँ,
लोग ये सब चीजें, यू नो,
नहीं
सीरियसली
करेंगे,
लेते नहीं है.
नहीं नहीं लेते. That is absolutely true. And I think there is always, you don't want to put people in a spot, na? So you're not going to
हम्म.
go and tell, okay, boss, even for that matter, let it be body odor.
हम्म.
You will try to go away from that person, but you will not tell him कि boss, तेरे तेरे कपड़ों में से स्मेल आती है, तेरे में से स्मेल आती है, and that is why I'm running away. you know
हम्म.
or indirect way of that is giving a deodorant to him and saying that this is your birthday gift, that
करेक्ट.
kind of a thing. And that too, if it hits him, it's okay. you know
हाँ.
अभी यहाँ पे तो तुम टूथपेस्ट और टूथब्रश भी नहीं दे सकते हो ना किसी को बर्थडे पे. बोले क्या है ये, मतलब ऐसे. सो
करेक्ट.
आई थिंक
In
आई
that
थिंक
case, gymming also, just to go a little bit
या
off track, gymming का जो ये issue तो नहीं बोल सकते, but gymming का जो trend है, अभी देखो, you are a dentist, तो आपके काफी सारे friends भी डॉक्टर होंगे, okay, in their 35 and 35 37s में. तो अभी देखो, जिमिंग ऐसी बात है कि आप नॉर्मल शेप में रहो, फिट शेप में, ऐसा नहीं बोलते एस्थेटिक्स बड़े बड़े बाइसेप बनाओ, बट नॉर्मल आप फिट रहो तो इट इज, यू लुक वेरी अट्रैक्ट. ओके.
करेक्ट.
बट क्या है कि लोग, आदमी, लड़कियों को छोड़े, एक बार मैं आदमी के पॉइंट ऑफ व्यू से बताता हूँ, कि जब तक वो शादी का प्रेशर आता नहीं कि अरे दिसंबर में मेरा एंगेजमेंट है, मेरे को शेरवानी में फिट होना है, तब तक लोग जिम जाते रही है. और नोबडी इवन पॉइंट्स आउट कि भाई तू जरा मोटा हो गया है, तेरा पेट ऐसा बाहर आ रहा है, तेरा शर्ट का बटन तो खुला है, तो वो सब होता नहीं है ये
अरे दैट्स अ साइन ऑफ प्रॉस्पेरिटी. मतलब पेट आ गया मतलब सेठ आदमी हो गया, ऐसे ऐसे
राइट.
या फिर. So, and that is true. In fact, even just before my wedding, I did all my dieting and everything, and now I'm absolutely careless about every single thing, you know. And about especially fitness, like I used to walk 5 kilometers a day, and for whatever reasons, I don't go out now. After the pandemic, in fact, I stopped going out because I saw people spitting left, right, center, and I was like, I'm done with walking. I don't want to walk anymore. So that's so वो होता है, मतलब as you said correctly कि शादी के पहले you want to, like, really be in shape, but after that you don't bother. True.
Right. Now, Ajinkya, as an outsider and even as a consumer, ये हम लोग ने टीवी में हजारों बारी देखा है, मे बी मिलियन और करोड़ टाइम्स, कि X product is suggested by 9 out of 10 doctors, okay, 9 out of 10 dentists, या whatever you take, depending on the product. तो ये 9 out of 10 का जो द सच है, वो क्या है डॉक्टर इंडस्ट्री में, कि why are they using this stat?
I'll tell you one thing again that stems out of having a synonymous branding. For example, you don't say photocopy, you say Xerox करके. तो अभी भी आप गांव में जाओगे ना, so toothbrush मैं Colgate करके आता हूँ,
हाँ.
that kind of a thing, so uh, a brand becomes synonymous with the verb itself, or that brand becomes a verb in itself. So I think for a large period of time, I think that was the case. Okay. Till you had a competitor entering the market. Like, even if I have to ask you to name toothpaste in India, okay, you probably might have 5 or 6 names, not more than that. Okay, and out of which 3 or 4 might be a recent entry makers in the market. Okay, so honestly speaking, SN9, honestly, if we dentists sit across and we ask which toothpaste do you recommend, okay, general population ko, we will have all random answers, okay, because we usually will say, "Arey, koi bhi de de." Honestly speaking, all dentists sitting in a circle, nobody is going to unanimously say, "Okay, buy this toothpaste." It is going to be कोई भी दे दे यार, मतलब क्या फर्क पड़ता है, that kind of, क्या फर्क पड़ता है is because the composition in the end remains the same. Now, for example, uh, you know, you have fever. Okay. Okay, now doctor will write a brand of medicine, but he'll not insist कि यही गोली लेना. He's not going to say कि यही गोली लो, इससे ही बुखार जाएगा, ये नहीं लोगे तो बुखार नहीं जाएगा. Right? You will go to the chemist, you will hand it over to him, he'll say, okay, ये brand available नहीं है, वो brand दे दो, चलेगा क्या? And eventually you will say, दे दो, because the salt composition is the same. Toothpaste में भी वैसे ही होता है. Only thing is that toothpaste is a OTC, it's over the counter, and you will take more of it like a preference. मुझे mint flavor पसंद नहीं है, मुझे ये flavor चाहिए, मुझे वो flavor चाहिए. So that is why we have different kind of toothpaste. Okay, a lot of it is thrill, a lot of it is marketing. Like for example, a lot of medicated toothpaste, like for example, Sensodyne. Okay, I'm naming a brand because
हाँ, वो sensitivity के related ही है, right?
Sensitivity. But now you will see a lot of patients कि कौन सी toothpaste use करते हो? Sensodyne. क्यों use करते हो? नहीं, वो toothpaste वो sensitivity था बीच में तो वो use किया, तो वो ही use कर. नहीं, किसी ने बोला Sensodyne बहुत अच्छा है तो वो use कर. But Sensodyne sensitivity toothpaste is supposed to be used for sensitivity. It's not for every single person who is having, it is not that it is going to prevent sensitivity कि तुमको कभी भी जिंदगी में sensitivity होगी नहीं, तुम अभी use करो. It's a medicated toothpaste. It's not supposed to be used. Colgate salt for that. A lot of things. I mean, they are not for regular use. They are not something that is going to do any kind of different benefit than your regular toothpaste. What we usually recommend or we tell the patient is have a good brushing technique more than your toothpaste. How you brush is more important. Okay, toothpaste आप कोई भी use कर सकते हो. I personally don't recommend gel toothpastes, the ones which come in gel format. Okay, I personally feel that they only have a fresh breath activity and they do not have a cleansing activity. And if you absolutely have to use Ayurvedic, there are a couple of toothpaste which I say, okay, don't use these, okay, because they are very abrasive, and instead use this particular brand. If people insist, okay, no, we want to use a Ayurvedic brand, so I say, okay, then you go for this. But if you ask me, do I have a favorite toothpaste or something I recommend, always? It's not like that. It's just that that's a very generic way. Use kar, it's okay, fine, because and the patient is also going to come you with that leading brand name only. He's not going to come and say, okay, मैं तो ये use करता हूँ. Okay, most of the times it is that particular brand that will come in, and we are like, yeah, okay, no problem. It's absolutely okay to use, because that's the general typical composition of a good toothpaste.
Right. Yeah, even as a consumer, देखो ये जब भी बोलते हैं, right, 9 out of 10 dentists recommend, I think it is a more of the fear of being left out वाला technique marketing used. कि देखो ये टूथपेस्ट 9 में से 10 डेंटिस्ट रेकमेंड कर रहे हैं, तो भाई आप कौन होते हो इसे चैलेंज करने वाले हैं?
Absolutely. Right. It's again in the end a marketing gimmick, it's how you so fear of missing out is one of the ways you could probably ask people to do that.
Now that you're talking about this so honestly, I think that now that it is an age of individual content creators, right? आपने देखा होगा काफी influencers एक niche पकड़ते हैं, ये वो करते हैं. I think now dentists should get into this space. I don't know how many dentists are there. I'm not aware of the stats, but dentists as an individual should take up a moral responsibility. It is enough of corporate telling these random stats 9 out of 10 wale doctors. And I produce content, and the toothpaste that I think is really good for my 10,000 20,000 followers, that is the toothpaste that I will क्या बोलते हैं, influence my my followers about it. I think it's a good idea that एक individuality भी बनी रहे. rather than just generic 9 out of 10?
Maybe. But to be honest, when people come and ask me what toothpaste should I use, so I say, what are you using right now? And if it's the right toothpaste for them, I say, okay, continue. But next month, change your toothpaste. I always recommend to keep changing your toothpaste to the right brand. I mean, to the right kind of toothpaste. Simply because I want क्या बोलते हैं? The oral microflora should not get habituated to one same kind of ingredient constantly. So I usually ask them, see, this is not research based, but this is what my science is telling me. For example, you get antibiotic resistance. Okay, like if you consume an antibiotic in a high quantity over a long period of time, that antibiotic you'll become resistant to that antibiotic. It will not act on you. Okay, with that same logic, I usually tell people that you keep changing your toothpaste and jump back to your previous one probably the next month after that, or keep trying, because there's no such thing for me as the best toothpaste. I mean, what is best for you? Freshness might be one thing for you. मेरे को tartar नहीं हो रहा है, तो it is the best toothpaste. My need and your need might be completely different. Like for example, I used a particular Ayurvedic brand, and I felt my mouth used to go dry after every use. I mean, the entire day I used to have a very uncomfortable feeling after that toothpaste. And I tell my patients, this is what I experienced. You try it out once, and if you feel the same, don't use it. Because again, dry mouth is not good for your teeth. So avoid using that. Essay. So for me, it's more so, I don't want to stick to a particular brand and say, okay, this is something that I would do. I would rather if I have to actually create content, I would create it on how to brush your teeth probably.
Okay, now Ajinkya, now we move to the last part of this conversation.
Yeah.
We have had a lot of talk about what mistakes we have been committing, etc., types of doctors and everything. Now we are, let's talk about at an industrial level now. Okay. Dental health या dental का जो expenses होते हैं, either it is not covered under insurance as an employee, or even randomly available कि मुझे समझ लो individually भी लेना है, तो it is not available. So why is this industry not being incorporated in the insurance policies?
See, in US there is definitely dental insurance. In India they wanted to bring it. I don't know what is the failure for not bringing it. But of what I understood when I attended a lecture where they were introducing, or there was a company who was trying to introduce, they had certain clauses which were a little impractical. So there was a clause which said you have to be ground zero, which means what? That you should not have any pre-existing condition. So if I have to grant you insurance, or if I have to give you that insurance, you should not have any cavity in your mouth. If you have, I mean, then you should get it filled before you apply for insurance. So the dentist should give you a ground zero that yes, this this person does not have any pre-existing cavities, gum disease, or anything of that sort. And you will realize that अगर मेरे पास कैविटी है, मैं अभी उसको फिल करवा लूं, तो मुझे इंश्योरेंस में मिलने क्या वाला है? मतलब आगे चल के मुझे क्या होगा? मतलब what is it that is going to happen? Because dental disease again is a very slow progressing disease. It is not something that happens अभी के अभी और कल हो गया, आज नहीं था, कल हो गया. It's very very slow progressing. It takes a lot of time to really come to a decay state and everything. That said done, it's just like probably your look पूछते अपने को insurance में, do you have any pre-existing disease? If you say you have hypertension and if you have diabetes, you'll be charged a little more on the premium side, right? Dental में, if they want to charge higher on the premium side, it would be as good as a dental treatment probably for him. So probably that is one reason where dental insurance is not coming into play, a pure dental insurance. But I know of a few companies who were doing OPD charges, but then again the premium was pretty high. I mean, they were giving about 10,000 rupees in OPD charges. Now you could utilize those 10,000 completely in dental expenses. You could utilize 5,000 in dental, 5,000 in probably getting new spectacles, 5,000 in a gym membership, and 5,000 in a dental checkup. That's completely up to you. But 10,000 they were giving in dental expenses. So yeah, so
So do
that
you
is.
think do you, do you see it becoming incorporated in the insurance policies in the future, like 20 or 15 years down the line, something as such?
I don't know, honestly speaking, I don't know, matlab, on the lighter side, if I have to say, I think Indians find a jugaad for everything. And when it comes to dental, उनको ऐसे डर है कि लोग इसमें कुछ ना कुछ जुगाड़ निकाल लेंगे, and that is why they are probably not coming up with anything concrete. Because guys, we are in 2022. I don't know what is stopping insurance companies from getting into dental insurance, and there's a absolutely perfect model they can replicate from the US. I mean, now we have Aadhaar card number, and everything. You could link a lot of things and get onto it, but for some reason, I think it's not happening, and probably because uh, maybe the cost of treatment is also the second reason. Probably could be it's a very not uniform pricing structure. So
Hmm.
what I'm being charged at Borivali might
Hmm.
not be same what I'm being charged in Bandra, and it
Hmm.
might not be same that is being charged in Vasai.
Correct.
Okay, so coming and the range would be, for example, if something is being charged maybe 100 rupees, in Bandra it might be charged for maybe 1,000 rupees or maybe even 2,000 rupees. So the
Hmm.
range is so huge कि तुम उसका क्या cap लगाओगे? Where would you stop? Where would you say कि okay, इससे ज़्यादा नहीं हम कर सकते हैं? I
Hmm.
guess that could be one reason why probably it's very difficult to streamline these things. And if we have to streamline, then the whole Dental Council of India has to come into picture and then probably get things arranged. And I think that could take a lot of time.
Hmm.
So I think probably that is one reason where the insurance is not falling into place.
Hmm. Ajinkya, you have emphasized a lot on the fact that dental healthcare is expensive in India.
Yeah.
Okay. But on the contrary, I have a few chartered accountant friends, and just randomly we were discussing about XYZ industry, and the dental industry came up.
Hmm.
And he told me that I don't know. It's obviously it is not everyone. ऐसा पूरा blanket तो होता नहीं है. But he told me कि lot of the dentist के साथ problem क्या होता है कि they aren't even able to recover the equipment का money. Is this true?
It is, I would say our running costs are very high. Our overheads kind of kill us most of the times.
Hmm.
Okay. One is there are a lot of recurring costs that are involved. Okay. One is upkeep of the instruments.
Hmm.
Okay. Instruments, equipments. Like नहीं नहीं करके month में कोई ना कोई एक expense related to equipment आपका आ ही जाएगा. And there are so many things that we use. Okay.
Hmm.
Apart from that, obviously, if you're in a rented clinic, there's the rent coming in. There's electricity bill coming in. You will have at least two assistants helping you out. Even if it's not two, then at least one assistant helping you out. Maybe one receptionist if your practice is decent enough. All of these are recurring costs which you have to pay irrespective of the footfall. Okay,
Okay.
कि आज patients है नहीं है, doesn't matter, you still have to pay this.
Hmm.
So recovering cost becomes a challenge. Okay, but I would also sometimes blame the industry and the way things are in certain parts of the country. Okay,
Hmm.
now for example, why do I say it in this manner is because Mumbai is saturated with dentists.
Okay.
Like
Hmm.
if you come down to Mumbai, you'll realize that there's dentist in every single building. So yeah, I think the costs involved in running a dental clinic now are quite huge, and uh, they can vary. Yeah, I mean, very difficult to really pinpoint and say, yes, it will break even or it won't. But yes, initial few days are a lot of struggle. Okay, unless you have a set practice, like if your parent is a dentist and he's handed over the practice to you, or you're practicing with that parent, then things might be a little easier. But if you're started from scratch, you are fighting a strong competition. And as I said, our industry in itself, is killing practices, because let's say I'm charging root canal for X amount. Okay, there will definitely be somebody who would be ready to do X divided by 2, at half the cost. Now,
So,
whatever materials they use, whatever they use, it's completely up to them. But that is killing practices, and then I won't be blaming patients, because patients have a choice, and patients will go for what is suitable, to them and for their pocket. So when I joined dentistry in 2003, था ही नहीं, मतलब ज्यादा लोग नहीं थे, ज्यादा डेंटिस्ट नहीं थे मेरे लोकेलिटी में. By the time I came back, there were so many dentists. So now in Mumbai, there's a saturation of dentists. But if you go to tier 2, tier 3 cities, they are getting saturated slowly. Okay. But still, somebody who probably graduated with me is doing much better in a tier 2, tier 3 city, because the competition is less. And by now, you have become an authority. In a suburban, in a urban place, you probably might not become the authority for that matter. You people might not even know you by name. In tier 2 city, people will know, okay, arey wo doctor, uske paas jao, that kind of a thing. Here, it's more of a matter of convenience. मेरे बिल्डिंग के नीचे है, because people are on the run, यार. It doesn't matter कि वो अच्छा है नहीं है, ठीक है, थोड़ा बहुत इधर उधर होगा, चला लेंगे, but मेरे बिल्डिंग के नीचे ही है यार, let's go and finish it off, that kind of a thing. So it takes time. Yeah.
हाँ, ये प्राइसिंग वाला तो इश्यू नॉट एन इश्यू, बट काफी वेरिएंट्स मैंने देखा भी है. नाउ आई विल टेल यू, इन द मंथ ऑफ अप्रैल में इंडिया में था, एंड मेरे को क्लीनिंग करवाना था. तो ऑब्वियसली मेरा एक फिक्स डॉक्टर है जिनको मैं जानता हूँ, बट उसके अलावा मेरे को थोड़ा था कि मैं जरा आजू बाजू में देखूं कौन क्या कर रहा है करके. वन गाय टोल्ड मी 450 में कर रहा है, एक ने बताया 500 में कर रहा है, एक 600 वाला भी मिला, और एक 1000 वाला भी मिला. तो वही चीज का इतना वेरिएंट देख के अभी ऑब्वियसली 450 या 500 वाले के पास ही जाएगा ना बंदा. That was like true to a great extent, man.
So
Right.
that is what happens there. I mean, and I guess that's the case with a lot of professions. It's not just us. Like if I talk to CAs, I'm sure they are going to tell me the same thing, because one CA is going to, and there's no standardization. The DCI has never intervened and said, okay, if you're practicing in this particular area, you are going to keep the charges as this. Okay, now I know my junior practices in very interior of Maharashtra. Probably there are 4 or 5 dentists there, but those dentists have come together and have set a price list. And they said, यही करना है, ठीक है, बट 4-5 लोगों में तुम वो कर सकते हो. तुम बॉम्बे में अभी मैं बोरेवली पकड़ लूं, या बोरेवली का एक एरिया भी पकड़ लूं, वहां पे अगर हम लोग 50 लोग हैं, मैं नहीं एक्सपेक्ट कर सकता हूँ कि 50 के 50 लोग यही प्रैक्टिस फॉलो करेंगे.
Correct.
So वो करना ही मुश्किल है. एंड आई थिंक you have to be happy with what you're getting, and my always aim is to do the best you can, but don't compromise on your values and say कि okay चल अभी काम नहीं है तो 100 रुपए में ही कर लेता हूँ, because वो कल तुम्हें जाके बहुत पिंच होगा. And one thing that I have realized after attending a few lectures and even after sitting with my CA, for you it might be a 10% discount, on the bill. Like तूने वो 90 rupees में कर लिया, but on your profit it is eating probably 25-30%. So so don't give discounts because you have no other work to do.
Correct.
Because that's going to cost you in the long run.
Right.
Yeah.
Makes sense. And just one last question now.
Sure.
Which you have told, spoken like 2-3 times. What is the right way to brush the teeth?
So right way of brushing the teeth, is, first of all, what is not the right way is, as I said, going horizontal with your brush and, brushing vigorously. What you have to do is, now it's very technical if I explain it the way I explain it to my patients, but you have to hold the bristles in such a way, or hold the head of the toothbrush in such a way that bristles half of the bristles are on the gums and half of them are on the teeth. Okay, and you give for your upper teeth, you give a downward sweeping motion. Okay, and if that is difficult to follow, so as you see, it's more of a wrist movement and not an elbow movement. Okay, if that is too difficult to follow, what we usually tell children, and even adults can follow it, is go for a circular action. Okay, because that will help you clean the teeth better. Also, the most neglected part of cleaning is the insides, like on the inside towards the tongue, both upper and lower. So make sure you're brushing that. And for the downward teeth, you again give a upward stroke. वो भी अगर नहीं जम रहा है, then you can go for circular. And as you said, flossing is important, and
Right.
cleaning your tongue.
Wow. Ajinkya, it has been a great conversation. Entire the 2 hours probably, or 1 hour 45 minutes that we have recorded, has been like constant information. There wasn't a part where I felt the need to even extend it. कि अरे थोड़ा और खींच लेते हैं करके, whatever it is. Genuine interest, genuine curiosity to know everything, and I hope people who have watched until this end will surely benefit from this entire conversation.
Thank you so much, Manan. It has been great, and let me tell you, I thoroughly enjoyed having this conversation with you. Honestly, it did not feel like I'm sitting for a podcast. It's more like two friends chatting and having their fun, discussing something that one is a part of and the other one wants to know more about. So thank you for having that genuine interest in our field, and I'm happy that I could share a little bit of my knowledge with you and everybody who's listening to this podcast. Wishing you all the luck for all your future podcasts, and may you grow by leaps and bounds. So thank you so much for having me over. I really enjoyed this experience.
Thank you. One thing I would like to point out is you did not hold back in giving away information. Although this is like, obviously this is not a monetized platform, right?
Absolutely.
And you giving out all the information needed and asked for, as like, it shows that you have the genuine interest towards your profession as well. ऐसा नहीं है कि अभी मेरे को फ्री में बुलाया है, मेरे को पैसे नहीं दिया तो मैं ऐसा आधा आधा information दूं करके.
No,
Thank you
yeah.
for doing this.
Thank you. Thank you so much. Thank you.
Yes.